Basically, what are today's conventional treatments for arthritis?
Cortisone became the most favored and usual treatment for arthritis in the 1940s because it gave an immediate and dramatic relief of symptoms. However, when it was discovered by Dr. Hench at the Mayo Clinic, he told us young doctors, and he received the Nobel Prize for it, that it wouldn't cure a darn thing. And doctors soon found that out. So since the 1940s, the non-steroidal anti-inflammatory drugs have been the drugs of choice. Now, they make the patients more comfortable, but again, they don't cure a darn thing. And that is where the treatment of arthritis, the conventional treatment of arthritis, stands today.
Then why did you decide against using cortisone?
After using cortisone for a considerable period of time, I discovered that it is not a good treatment for arthritis. It's only a crutch for the patient to reduce and relieve temporary pain and swelling of the joints. If the treatment is continued, there are often devastating results. For example, Cushing's syndrome, where women grow hair on their face. They have swelling in their feet and legs. It can cause heart disease, it can cause cataracts, and sometimes devastating damage to their bones and joints and osteoporosis. So while it is still used in small joints and small cases for short periods of time, it is not a drug in which doctors can depend on for long-term treatment or long-term results.
Now we know that cortisone is not the answer. Are over-the-counter and other prescription drugs the solution?
No, they are not. The over-the-counter drugs which patients buy in the drugstore, such as aspirin or aspirin substitutes, only help the patient temporarily with a little pain, a little swelling, a little stiffness, and the effect soon wears away. The drugs which doctors give on prescription, such as the non-steroidal anti-inflammatory drugs, are not much better. They're more convenient to only take 1 or 2 a day perhaps. But at the end of a year, taking these drugs, the patients find that they have not recovered from their arthritis. Their arthritis may be worse. The best way to treat arthritis is to help the body heal itself. And that is the purpose of all of the items in the arthritis pack.
What kind of medicine comes with the Desert Arthritis Pack?
The only part of the arthritis package that might be considered medicines is the arthritis vaccine. This is a non-specific vaccine. It is not directed against any one organism or protozoa or virus, but helps build the resistance of the body up to all of these infectious agents. The other parts of the arthritis program help support the treatment with the arthritis vaccine, but the action of the arthritis vaccine is not specific.
How does a non-specific vaccine help to fight arthritis?
Every person has a certain amount of immunity. This is called natural immunity and is present from birth. As one gets older, this immunity may decrease or in some people become completely absent. As a matter of fact, for many years, rheumatologists called rheumatoid arthritis an autoimmune disease. They thought a person was immune to the things in their own body. Now we find that that is not true, that a patient has an immune deficiency syndrome developing from infections or other invasive or metabolic forces. Now, the vaccine itself builds up a patient's immunity and gives them an acquired immunity. It's nonspecific. For example, Dr. Bellew, who is one of the discoverers of this vaccine, was trained in ears, nose, and throat and allergy. And he noticed when patients received their shots for colds or flu, or when they received their shots for influenza, their arthritis got better. So it came to him that why not combine these vaccines, and which he did, and which we used in our clinic, and we found out that the patients were overcoming their arthritis pain and stiffness and swelling, and that the vaccines were continued because they have a short period of life, 3 to 6 months or not longer than a year. They could be free of these painful symptoms of arthritis the rest of their lives. Now, the vaccine itself works in 3 ways. It stimulates the white blood cells of the body, which overcome infection from viruses, bacteria, and protozoa. It stimulates the fibroblasts in the body, which help repair damaged joints. And it also builds up an immunity against new infections which may come into a patient's body from outside sources, like we used to call them foci of infection. So the vaccine has a triple purpose: to prevent and overcome infection and to build up the patient's body and resistance.